Hello and welcome to McLaren-Port Huron's Today's Health Program. I'm your host, Michelle Baker. Joining me today is Pulmonary and Critical Care Specialist Dr. Michael Basha to talk about asthma and newer treatment options for it. Dr. Basha, welcome back to the program.
Thanks for having me, Michelle.
Let's start with what is asthma?
Well, asthma is a very interesting disease in that it is a disease which is characterized by inflammation of the bronchial air tubes and constriction of the bronchial air tubes. And because of the inflammation and the constriction of the bronchial air tubes, patients have a difficult time breathing. So typically patients will have difficulty with breathing, coughing, wheezing, chest tightness, shortness of breath, phlegm production. Those are the classic symptoms of asthma, although some patients may have all of those symptoms. Other patients may just have cough, for example, and so it can vary from patient to patient.
Now, we've all heard about patients who have asthma attacks. What are asthma attacks and what cause them?
Well, asthma attacks really are an acute flare-up, an acute exacerbation of chronic bronchial asthma. So these are patients who typically will have asthma which is relatively well controlled, and then because of some reason like an environmental allergen or a viral infection or cold air or some certain perfume, cologne, cleaning agent, the patient will have an acute exacerbation or acute flare-up of their chronic bronchial asthma. This is when the airways really constrict down, there's acute inflammation of the airways, the actual bronchial lumen or the opening really narrows, and patients will have a more exaggerated asthma response.
Who is most at risk for getting asthma?
Well, asthma is a very interesting disease. It's a disease that's probably genetic in origin, although there may be some environmental and viral factors which contribute to the development of asthma. We don't really understand a lot about the genetics of the disease. It's a very common disease. 7% of the U.S. population has asthma. That's about 21 or 22 million people, a third of which are young kids or young adults. So it's a very common illness. We don't really understand why some get it and some don't.
Is the age of onset usually very young in childhood, or is it possible for an adult to all of a sudden develop asthma?
Well, it's really bimodal. So we see a lot of kids who develop asthma at a relatively young age, 3 and 4 and 5 years of age. They develop what we call extrinsic or allergic type asthma, and typically by the time they're 15 or 16, they grow out of their disease. And then we have adults who develop asthma at a much older age, and that asthma is what we refer to as intrinsic or idiosyncratic asthma, and that asthma tends to get worse as the adult gets older. And so we really see two patterns.
And what causes asthma?
Well, as we mentioned earlier, asthma is probably a genetic disease, but there's some viral and environmental factors which contribute to the cause of the disease. But we think it's genetic. We don't understand really the genetics of the disease very much, but there's clearly a genetic predisposition to the development of the disease.
Now, are those who are exposed to secondhand smoke, is that as much a risk factor as those who actually smoke?
Well, secondhand smoke is a risk factor in a couple different ways. One is secondhand smoke can actually cause chronic lung disease, such as chronic bronchitis or emphysema. And the other issue with secondhand smoke is it can trigger somebody's asthma if they have pre-existing asthma. So the secondhand smoke can be a risk factor in a variety of ways.
Are there certain medical conditions that can predispose you to developing asthma?
Well, the one in particular that we concern ourselves with is something called respiratory syncytial virus, or RSV infection. This is an infection that we see typically in younger kids or infants actually, and those people who have this RSV infection are at higher risk for developing asthma, either as a young adult, teenager, or actually even as a full-grown adult.
Are there certain medications that if you were on them for a long period of time can also predispose you to developing asthma?
Well, yes, there are certain foods obviously which put you at high risk for allergy, and then there are other medications which can constrict the bronchial air tubes and can cause sort of an asthmatic-like response. The one that we concern ourselves with the most are so-called beta blockers, which can actually predispose someone to development of asthma or exacerbate somebody who does already have asthma.
Dr. Basha, this is great information. We need to take a break. We'll continue in a moment.